Good afternoon, everyone. This is Dr. Martin, Institute of Regenerative Education. Happy Monday. Now, I had planned on a completely separate lecture today. I had this fabulous doctor who's doing just beautiful work with ketamine and other elements, has a massive addiction clinic, and he asked me about the application of biologics in addiction. And so I spent countless hours this weekend going way down a rabbit hole. And that's what I was going to present on today, but we're going to have to move that because this has now kind of 3 calls today all brought up the same thing. All right. And so we're going to get into this. Today's lecture is called Post-Thaw Bullshit. And you all know me, I'm exceedingly blunt, and so we're just gonna lay the facts out as they are. So, as most of you know, I'm one of the few experts in the country that testifies at the federal level of appeals. I've testified at the Attorney General level, the medical board level, the ALJ, the quick, tertiary level of appeals, even quaternary level of appeals. I've testified in front of the Office of Tissue Inspection, which most people have never even heard of. I want to walk this through with you because I need you all to understand what a canard this is. There are 1 or 2 brand new companies that are talking about whole birth tissue products that are cryopreserved, and they are selling them on post-thaw analysis. Their post-thaw analysis is the most potent in the regenerative medicine space. What a monster pile of bullshit. Now, if the bullshit wasn't deep there, I mean, they're just digging it with a shovel here, right? They brought in like the full-size cat digger, right? With the big, huge plow front on it. And they're just digging pounds and pounds of bullshit with this. And this is where it's important that we get into it, all right? Now, all of you have seen me write this, that the FDA is your friend. And the FDA is your friend as long as you comply with federal guidelines. But when you start to get cute, things can happen. And we're going to get into what's going to happen to a lot of providers who dive into the use of these products. Now, these providers are saying, hey, look, we're not a drug. We're not a 351 product, right? We don't have an indication, right? And we don't make claims. But we are a 361 product. And the reason we're a 361 product is because we are manufacturing in an AATB facility, right? And we are homologous use. Okay. And this is where the rubber meets the road, all right? For any of you that have ever seen me lecture, you know that I defended providers that used all sorts of amniotic fluid and Morton's jelly products at the federal level of appeals when Medicare was clawing these payments back because of this, homologous use. This has never been won at the Federal Court of Appeals. At no point in time has any doctor ever won a case in federal court for having used a product that was homologous use. It's never happened, right? I've won, but not based on this argument at all. There are a few tenets of homologous use. And the first one is that the product is non-combination. Now, I'm not a smart guy, and I say this all the time. 90% of you are smarter than I am. I just read a lot and I assimilate information quickly. If I have a product, an all birth tissue product, that includes umbilical cord, the whole cord, that means it's Wharton's jelly plus umbilical vessels, plus all the blood that's in the umbilical vessels, plus the epithelial layer, and, because this is combined, placenta. In the eyes of the FDA, that is a combination product. We had companies, R3, that was out there, and the reason they were initially called R3 is because they were taking 3 tissue subtypes and putting them all together. They were taking Wharton's jelly, an amniotic membrane, and amniotic fluid, and combining all 3 together in one product. Hence the name R3, 3 regenerative products. Well, unfortunately, that's a combination product. If you take amniotic fluid and mix it with Wharton's jelly, it's a combination product. If you take amniotic fluid, Wharton's jelly, and umbilical cord tissue, that's a combination product. If you take the whole placenta and the placental disc, and you take the entire umbilical cord with all the umbilical vessels, and you grind it all up in a blender, and then cryo-freeze it, that is definitely a combination product. And so the fact that this company with this cell factor product, right? They don't even call it Wharton's jelly or a birth tissue product. They get cute, right? Like a cell factor or a cell factor media product. These are just cute synonyms where they literally went into thesaurus.com and typed in Wharton's jelly, and they're like, okay, what else can we say? Because we don't want to say it's Wharton's jelly, right? And maybe the FDA is not going to assail us for that. These are all combination products. If you're combining all of umbilical cord, that's a combination product. Wharton's jelly is just Wharton's jelly. It's not Wharton's jelly plus umbilical cord plasma plus epithelial layer, right? It's just the Wharton's jelly. If I take an umbilical cord with the 3 blood vessels inside, and there's blood in all these vessels, and I take the Wharton's jelly here, right? A Wharton's jelly product means that I open the epithelial layer, I strip out the 3 blood vessels, and I cleave off just the Wharton's jelly, the primordial tissue that cushions the umbilical vessels. Right? That is a pure product that can be processed in a minimally manipulated way. But if I just take the whole umbilical cord and I throw it in a blender and I put it in my Ninja blender, right? The way my son makes a protein shake, right? And then I just throw it in a cryo freezer and I'm like, sure, that's homologous. No, it's not. No, it's not. Not at all, right? So they're saying it's a homologous product and it's 361, but it's a combination product. They're combining placental tissue, amnion, chorion, intermediate layer, placental disc, plus all the subcomponents of the umbilical cord, and they're saying that that is a non-combination product. That's like saying, okay, right, I'm going to take foot and toenails and blood vessels in kneecap and shoulder and porcine tendon and blend it all together, and that's not a combination product. It's the stupidest thing I've ever heard, right? But that's not the problem. The problem is much, much more sinister. And I'm going to tell you why. And the company's not going to tell you why because they don't care, right? They don't have an MD who works for a completely separate company like I do, right? Let me make this clear. I don't work for Platinum Biologics. I'm the Chief Medical Officer for the Institute of Regenerative Education, which is where I get paid. I have no stock, no ownership, no share in Platinum Biologics at all. There's not a single Platinum rep that pays me a thin dime off their commissions for anything that they sell. I've just used everything else and it's trash. Why do I like platinum so much? It's what I use on myself, it's what I use on my family, and everyone else is either lying or their products are trash. So why is this product complete trash and you should stay as far away as possible? Well, let's get into it. Why does platinum only use, here's platinum up here, right? Platinum only uses umbilical cord tissue from full-term C-section deliveries. Well, I'm going to tell you why. We're going to use blue for this other. This company is going to use any cord that comes along, right? Now, the reason platinum only uses umbilical cord tissue from full-term C-section deliveries is for a reason. It's not just cute, it's for a reason. When the baby goes through the birth canal, there is a risk with vaginal delivery tissue that the head or the shoulders are going to compress and they're going to rupture blood vessels inside the umbilical cord. When that happens, you get mixing of maternal blood with fetal tissue. When you get mixing of maternal blood with fetal tissue, you run the risk of graft versus host. Why? Because the Rh factors in mom's blood is now mixed in with that fetal tissue. Now, have there been companies that have had graft versus host issues this year? You betcha. And we know who they are, right? They're using vaginal delivery tissue. We know that because they're getting graft versus host. Why would a company use vaginal delivery tissue? Oh, because it's cheap. Vaginal delivery tissue that is not screened for COVID is probably $500. Umbilical cord tissue that's C-section only, that's screened for COVID, can be as high as $5,000 a cord. So companies that are starting out, companies that aren't doing very well, companies that aren't very well capitalized, right? Companies that run out of products every 3 months, right? Companies that aren't paying their reps and are taking their reps' accounts, right? To save money, they buy vaginal delivery cords and they roll the dice with your license. So if you happen to use this stupid company that says they're, Scouts Honor 361, but read between the lines, what are they really giving you, right? Oh, I wonder what they're giving you. Because it's not a non-combination product, which is one of the first tenets that makes it a 361 product, because it's more than minimally manipulated. It's not homologous use. So when you give that patient that whole of umbilical cord product, which is definitely going to have blood from mom, it's definitely going to set up a scenario for graft versus host, what happens? Oh, patient gets sick and they go to the hospital. When they go to the hospital, who does the ER call? The ER calls your office. Oh, we use this bullshit product, right, because of its post-thaw viability, right? That's cute, but your patient's in the hospital with a graft versus host. What's the name of the company? What does the ER then do? Oh, they call the FDA and they report you and the product you used, because that's a serious adverse event and they have to report it or they're liable. Now here's where it gets fun. For all of you who think this cell factor product is the best thing since sliced bread, right? When the ER calls the FDA, right? The FDA then calls your lovely med board. And when the medical board hears about the fact that you used this whole of birth tissue product that was guaranteed 361 because some PhD made it, right? And because he's definitely the best person to tell you how to practice medicine because that PhD's practiced so much medicine in their life. Oh, let's think about that for a second. How much medicine has a PhD practiced? Has a PhD ever put an IV in a patient, ever stuck a needle in a patient, ever treated a patient, ever written a prescription for a patient? Can they even write prescriptions? No, they can't do any of that. Have they ever had malpractice? No, they don't have that either, right? So who's really liable? The PhD who said, Scout's honor, it's safe, right? Or you? Oh, it's you that's liable. Because guess where you sit? Oh, you sit right here. Here's you with your great big heart for this stupid cell factor company. Oh, I love them so much. They bring me crumble cookies every week. Well, okay, right? Well, guess what? You get to sit in front of a court of your peers, right? In a court of your peers from the medical board, right? And from the FDA, now get to start asking you questions. And so if you used a product that was whole of umbilical cord, which is not homologous use, right? You used a drug, a non-approved drug on a patient in the United States, and that patient went to the emergency room. And it's not enough for you to say, I just didn't know. The rep told me. Oh, what rep? Oh, the PhD. Who's employed by the company or who owns the company. He told me it was super safe and it was 361 compliant. Medical boards have quotas. They have quotas for doctors that they need to and have to investigate. You want to talk about silver platter. An adverse event that goes to the ER with a graft versus host. When you used a whole of umbilical cord tissue product plus placental product combined in one Frankenstein, because that's all this is. This is Frankenstein, right? This is Mary Shelley, right? Whatever, I can't remember when she published Frankenstein, 1857, I think, right? 1897, I can't remember which. This is Mary Shelley. This is Frankenstein, right? Nothing good happens when any Frankenstein product is brought to life. And that's what these folks are doing. They're selling Frankenstein products, right? Well, I can tell you what, when the medical board investigates and when the FDA investigates and your defense is the rep told me, you're screwed. You are screwed. Take it from somebody who did 4 years of probation for the Medical Board of California, right? They took charts of mine from 2006 and applied narcotic prescribing guidelines retroactively 10 years to put me on probation. I had to activate a retired license because you can't have an action against a retired license. It has to be active. I had to activate a retired license just so the board could take action against my license. I'm telling you, if you were on their radar, they just got the biggest gift, and it's Christmas in whatever we're in, May, right? And you are on the menu. So are there going to be more cute products that come out like this? Of course. Are they going to make very tall promises about how marvelous their products are, how they're definitely 361, how they definitely comply with the state of Florida or the state of whatever, right? Because more and more states are going to produce stem cell bills. Buyer beware. Buyer beware. Set up a call with me, right? Go into the IORE, post a question. I will usually DM you with my cell phone. Let's talk. Let's talk it through, right? Because at the end of the day, and I've said this a million times, I don't ever want any of you to suffer what I went through for 4 years at the medical board expense, right? I lost My license was on probation. I still have a blemish on my license in both states that I practice, Nevada and California. Even though I have active and unrestricted licenses in both, I have a blemish on both licenses. They stripped me of my boards, right? That alone is brutal enough. I would want no one to have that happen to. I've lived this. So if you think that I'm just a shill, no, I've lived it. I've been through it. I've testified on physicians' behalf going through this. I'm not telling you because I haven't been under oath in front of federal attorneys arguing just these facts. I have been multiple times and I continue to be. So I can speak on it from an educated standpoint. I'm not employed by a company who's trying to make a commission selling you a product. That's not the case. If I sound emotional over this, this is like the second time today a provider's asked me about this. And I make these videos for a reason, because a year from now, 2 years from now, you're going to see another company come up with another bullshit Frankenstein product in tout concentration of MSCs or, the least fragile MSCs or some other marketing bullshit, right? And that's all it is marketing bullshit. What do I care about? Safe and efficacious. This is why we created the IRB, right? We created the largest observational registry to follow safety and efficacy, outcomes longitudinal for any regenerative product that you want. Doesn't matter what regenerative product you want. Peptides, whatever, right? EBU, ozone. Sure, we'll track the data and we'll see if it's safe. Number two, if you can't reproduce the outcomes and a provider who lives nowhere near you can't duplicate the outcomes that you're getting or the company's getting, the product's bullshit as well. Your outcomes need to be safe, they need to be efficacious, they need to be reproducible and duplicable. And then and only then is that a product you should use, right? And this is what I have tried to help educate to in the Institute of Regenerative Education. It is always an honor to talk to you all. If I seemed a little wound up, I was, right? Because these companies do a great job of marketing, but they are not going to do a great job of protecting you. I'm Dr. Martin. Have a very blessed day.